Masala Radio.
Today, Dr. Rodriguez is in the studio. A friend of mine, my doctor, somebody that I Sunil guarantee. He is a great guy, great cosmetic surgeon, and we'll give you the great advice. But let's begin with the difference between traditional liposuction and what you do best is the new procedure.
Nope.
So tell me what it is and what is the difference?
That's a fair question because that's a confusion that most people actually have. They associate liposuction with, oh, it's going to be hurting, I'm going to be knocked out, am I going to wake up, I'm going to stop breathing. With this breakthrough technology that I employ today, we can actually remove those unwanted fat pockets with the safety of just local anesthesia. So you don't have those concerns. The way that we can do it is because with traditional liposuction, you have to be knocked out because the surgeon may use some big instruments that hurt a lot. And because they use big instruments that hurt a lot to be able to suck the fat out faster, obviously with a bigger sucker, a bigger straw, after the procedure, people experience a lot of pain. Nobody likes pain, Sunil. Many patients may have to take narcotic pain medication.
I mean,
for a week or more.
it sounds painful, putting in a big straw in my stomach or in that layer of fat and sucking it up.
Right.
It sounds painful.
Right. But now what I do, I use a special type of technology to break down the fat. I turn the fat from fluffy solid fat to about the consistency of a Slurpee or smoothie. A smoothie has a lot of solid ice, but the ice is broken down in such small little pieces now that you can suck up solid ice through a narrow straw. So that's what I do by breaking down the fat in the places where you don't want it, and then I can use very small, delicate, fine instruments to remove the fat from the places you don't want it with minimal trauma and minimal pain. That's what allows me to do it with just local anesthesia. But more importantly, since I didn't beat you up so much to get rid of the fat that you didn't want because of the delicate instruments I use, there's less pain afterwards. The recovery time is markedly reduced. I have patients that go back to work the very next day. Most of the patients that I treat never have to take strong narcotic pain medication afterwards. So they're able to get back to their normal function, minimal downtime, minimal pain, and actually by melting the fat first, I can get superior cosmetic results.
And you do this in your office. I don't need to go to a hospital, overnight stay, I'm knocked out on a general. It's in the office over a period of a few hours.
Right, and it's an in-office procedure done safely in an office setting. So you actually even save some money. You don't have to pay for a hospital fee.
Right.
You don't have to pay for the extra doctor anesthesiologist to knock you out and make sure that you wake up. So it's actually a much more acceptable way to get rid of your unwanted fat for most of the patients that I see today.
This is, it's done right, and it's new technology. And it's called, the name of this procedure is?
This Vaser Lipo selection. One of the concerns, too, that a lot of patients have is, okay, once you suck the fat out and it's all deflated, so to speak, is my skin going to be all saggy? If you deflate a balloon, the balloon looks saggy. The nice thing about this is that heat that I use to melt the fat, I also apply that heat strategically under the skin to promote tightening of the collagen in the skin. So you get a tighter envelope over the area where the fat has been removed. You don't get that with the old-fashioned lipo, where you actually traumatize the skin more. You may even traumatize the blood vessels that you need to take blood and oxygen to the healing skin. So the skin heals up nicer using this technology as well.
So this is 2-in-1. It gets your fat out, less trauma to your body, and it tightens your skin because you heat that skin.
Correct.
How do you heat the skin? That needle that you put in, is it a heated needle?
Well, there's a little tube that I place underneath the skin that generates ultrasonic energy, and it vibrates very quickly through the fat. It's like rubbing your hands together really fast. You feel the heat. Well, I can heat up the fat to melt it, but I can also heat up the underside of the skin strategically to get it to the temperature that you need to make sure that it stimulates remodeling of collagen in your skin. The way that happens is, essentially, I'm faking your body out into thinking that your skin got burned. when it really didn't. If your skin, yes.
Also, basically, the body thinks your skin is burned, and it's trying to
make new,
regenerate.
Exactly. One of the most commonly asked questions related to liposuction, people say, okay, Dr. Rodriguez, when you remove the fat from this area, is the fat going to go someplace else?
Or come back in that same spot. Like, what if I remove fat?
But because it's not going to come back in that same spot.
Why not?
Once I remove the fat cells from there, that part of your body can never store the fat there the same way ever again.
Oh, really?
Yes. What happens is that if you don't take care of yourself, now you're taking more calories than your body actually needs, your body finds other pockets where there's fat cells that say, hey, come over here. Dr. Rodriguez didn't get us. You got plenty of room over here for you guys to live. And then you just start storing the calories in other parts of the body that Dr. Rodriguez didn't remove the fat from. People pour in thousands of dollars to maintain a nice home, to maintain their cars, for nice clothes.
Yes.
Put in a little bit of effort into maintaining the only thing you can't trade or sell when you get tired of looking at it, your body. So it's going to require some investment of time and effort to look your best. It's going to require some investment and some sort of ongoing maintenance to continue to look your best. Just like if you go work out at the gym, you can't do it today and quit. No. People need to invest in themselves, do what they need, and we actually coach you on how to do that because I want you to look great after I do your Vaser Lipo.
You were just telling me a little while ago why you like doing this so much. And I think that's a valid question. What do you get out of it?
Okay. The thing that I enjoy the most, first, it's a cool thing to be able to sculpt somebody's body, okay? I'm not going to lie about that. That's a cool thing. And I may even do this for grins if I wasn't getting paid. But I still have my bills to pay, okay? But the nice thing that I like is not just what I can actually do physically to the body, but it's what it does for people's self-esteem. What it does to make people feel good about themselves. After all, that's why we do a lot of things. And it's good to be good to yourself. And I love to see the satisfaction that people get, the confidence that it gives people. That's the most rewarding thing, to see how something like this new technology in my hands, can help to change people's lives for the better.
Masala